So as an L&S undergrad, having done the Spanish major and then also done these prerequisites, what is your advice to students who want to explore a career path in pharmacy, but may not have that typical STEM major as pharmacy students?
And I feel that is becoming probably more and more common. Either students will have a non-traditional or non-science degree or certificate in addition to a science degree going into the healthcare field. And it's all, either way, every student still has to do the prerequisites, your chemistry, biology, physics. So at baseline, everyone has to complete that. So you're not, necessarily missing out on having a non-science degree going into pharmacy school. And it's more being able to think through the process of how will this degree help advance my future career and future profession as a pharmacist. You want to make sure that they match or at least complement each other. So that's where I really felt that I had volunteered in high school and undergrad and pharmacy school, and I really had a passion for serving underserved patient populations and communities. So one of the ways during pharmacy school and actually still, not since COVID, but pre-COVID, as a practicing pharmacist, I volunteered at a free medical clinic through UW-Madison that's run by medical students and pharmacy students and nursing students. And I actually that was the literal application of I am speaking Spanish as a student pharmacist and working in a healthcare setting while using both of those skills, so Spanish and pharmacy at the same time. So then, at times I'll be, speaking to a patient in Spanish and giving them their flu shot at the same time. As you gain experiences throughout pharmacy school in your rotations, you will know, pharmacy isn't just the pharmacist behind the counter at your local pharmacy. They're the ones behind the scenes at the hospital, making sure, your medications you're getting are safe for you. And they're the ones, who are doing drug development research, and they're the ones in the schools teaching the future, pharmacists. And I was really, I went into pharmacy school thinking, there's only two paths and that's it. And you learn that there's 1,000,000,001 different potential career options just with a pharmacy degree. It's definitely a degree that will open up a lot of doors, and you can go into a lot of different areas with it. And that was where, I flipped from hospital to ambulatory care to a more clinical role. And with my shadowing experiences and fourth-year rotations in ambulatory care, that's really what solidified that interest for me.
Can you think of any examples of different paths that classmates of yours are perhaps exploring or have started working in non-clinical settings?
Yeah. So one of my close friends in pharmacy school, she started out in community pharmacy and retail in northern Wisconsin. And probably about a year or two ago, she transitioned into the pharmacy benefit management side of things. So like insurance, reviewing prior authorizations for medications. So she doesn't see any patients. It's all more kind of the behind the scenes role there that she does. A lot of students are really interested in management and administration. So that's not a direct patient care role, but pharmacy, as a whole, I think they've done projections in the next 5, 10, 20 years, and there's going to be a deficit of pharmacy leaders, and they've really been incorporating that into residency training and into pharmacy schools. So administration, management, owning your own pharmacy, owning your own business. UW-Madison, the pharmacy school, recently started a new I don't remember the exact terminology for it, but kind of like a business certificate or concentration that you can do while in pharmacy school, which was not offered when I was a student, so that's something relatively new. I also know someone who works more on like the public health side of things, so not really as a practicing clinical pharmacist, but they work more for public health, CDC, WHO type deal for like vaccines.
So when you were in pharmacy school, did you have an idea that you wanted to be in a hospital setting versus in a retail setting?
So in pharmacy school, we have sort of shadowing experiences. They're called Introductory Pharmacy Practice Experiences, or IPPEs, IPPEs. Everyone loves all the acronym. And you do an IPPE in a community setting, you do it in the hospital, you do it in retail, and kind of all over. And initially in pharmacy school, I was like, nope, I'm doing hospital pharmacy all the way, and that's it. I know what I want to do, and I'm sticking with it. I can't change it. And actually, in second and third year of pharmacy school, we have what's called pharmacotherapy lab. That's where I kind of describe it as you really, really learn the essential skills of how to be a clinical pharmacist. And that's where you have your standardized patients and your practicing cases and going through everything with your fellow students. And actually, that was where we had residents do teaching. So they serve as sort of TAs or teaching assistants through the pharmacy school. And there were VA pharmacy residents who were in our lab throughout a whole semester, and they were telling us what they were doing at their job, and I was amazed. I didn't even know pharmacists could do that when I went into pharmacy school. I thought it was the coolest thing ever, and I shadowed at the VA a couple of times, and I was really impressed, and I'm like, that's it. That's what I want to do.